This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Welcome, everybody. I'm so glad that you decided to come and listen to us here and let us share our program. I just quickly want to introduce our team that should be on the phone. There's Dr. Robert Balch, our Associate Program Director. You there, Bob?
I'm here.
Yeah,
hello,
perfect.
everybody.
And then we have Dr. Ahmed is here. He's our one of our program residency chief residents.
Hey, guys. Here.
And I think Evan Wright is on as well. He's another one of our residents. Dr. Ahmed is our PGY3 and Dr. Wright, PGY2.
Hi, everyone. Thanks for coming out.
Very good. And of course, Maria, you're still on the phone, right? She's our residency coordinator, the one who holds it all together for us. But,
hello, everyone.
You can move us ahead on the slides, please. So just as I just kind of want to quickly go through a lot about the program. We're very proud of it, a lot to tell, but I want to leave time for questions and answers. So you're going to hear me kind of go quickly through the slides, and so we can get to questions and answers. You have a chat ability there, and if you'll type in chat questions, Maria can read those back as they come along, and I may try to answer some as we go along, but then also, of course, at the end of the program. So we're fully accredited by the ACGME. Our institutional primary site's a 66-bed inpatient rehab hospital, but we're also paired with a 40-bed another hospital, Texas Rehab Hospital in Arlington. So Fort Worth and Arlington together. We're CARF accredited at the Texas Rehab Hospital Inpatient Rehabilitation Program located in the medical district of Fort Worth. It doesn't say this on this, but Texas Rehab Hospital is one of some 60 inpatient rehab hospitals owned by LifePoint. Ours locally is in coordination with the largest private hospital in town, Texas Health Resources, or the Harris Hospital downtown. And we are just now recruiting for our third year of residents. And our program has just been growing and progressing very admirably. We're very happy with it. So we go ahead and move the slides. So we're a categorical 4-year program, bringing people into a first year at Texas Health Resources in internal medicine under Dr. Ryder. They're also a relatively new program, but so we bring in 6 new residents each year, and that's what we're talking about now. We have 11 affiliated rotation sites. I'll go over those in more detail. But essentially, we're teamed up with the largest health science center medical school in Fort Worth, with the county hospital, and with the largest children's hospital, and of course the Texas Health Resources. And of course, the academic affiliate is the University of North Texas Health Science Center, Texas College of Osteopathic Medicine. And it's a large health science center with a medical school, a graduate school, a school of public health, a pharmacy school, physical therapy school, physician assistant school. It's a school of health sciences, so it's a tremendous resource, and they are academic affiliates for many residencies across the state, and are one of the nation's leaders in graduate medical education, faculty development and support. So the clinical training sites, Dr. Balch is on one of his clinic. Balch Interventional Pain is part of us. Our program, the Center for Neuroskills, is a brain injury program we work with. Of course, Cook Children's Hospital, a major player in North Texas. John Peter Smith, the county hospital, and the JPS helps us in several ways, including our occupational health and sports medicine. We have an electrodiagnostic clinic that full-time EMG nerve conductions. We have Texas Orthopedic Associates, Texas Rehab Hospital, Arlington, all these I've sort of already mentioned. I'll go into the more details of these as we progress. The CRM you see there is at Dr. Balch's clinic where he does interventional pain. So North Texas, Fort Worth, an amazing place. If you don't know of it, it's I think the 10th largest city in the country, the fastest growing city in the country. It's got a few pictures here of part of JPS at the left, Texas Health Resources, a picture of that at the top. Fort Worth is historically considered where the West begins. We somewhat consider Dallas a more eastern city from our perspective, and Fort Worth is where they used to drive cattle from across Texas up to the Fort Worth stockyards to be loaded on trains to go to the Midwest. It's just a growing, dynamic area. They've got just next door in Arlington, the Dallas Cowboys stadium, as well as Texas Rangers stadium. And I could go on and on about the area. If people have questions, I'll be glad to discuss that further, but we can go on from here. The directors, as you see, myself as the program director, Dr. Balch is on the line, associate program, Dr. Bridges is another associate program director. And as I mentioned, Dr. Hillary Ryder is over the first year PGY1 internal medicine program that's part of ours. We have a lot of benefits, and I know everybody who's interested in coming here is looking at the competitive benefits between different places. We have all residents have gym memberships to LA Fitness and several other national chains of gyms. And so really, wherever you like to go, you'll have a membership on us. You'll be able to be fed when you're in the hospital throughout the program. Parking, of course, is included in competitive salaries and benefits. I believe 4 weeks paid time off, paid vacation, plus holidays, plus, as you can see on our website, the salary changes from year 1 through year 4 are all listed on our website. But again, if you have questions about benefits, please ask. Curriculum, again, could go on. We're really excited about it. We have a half a day every Wednesday afternoon. The faculty have divided up the breadth of PM&R education, and each takes a section. There's dedicated research days where you can do quality improvement projects or required research during the residency. We have medical students who are rotating with you, underneath you, and along with the faculty. It gives you a chance to mentor the next generation as you're learning yourself. At the Health Science Center, there's a state-of-the-art for immersive virtual reality simulation center. There's a manipulative medicine labs. There's cadaver labs, different things that we use them, as well as, of course, access to the library, amazing resource. We have workshops in the curriculum, hands-on electrodiagnostics, of course, ultrasound, which is growing in importance, osteopathic principles and practice training and workshops. There's a lot of hands-on as well as the didactic program. And of course, for professional development, we have a great mentorship program between the residents and the faculty, as well as junior residents paired with senior residents. Of course, you're taking your assessment exams for the residents. This is kind of board prep. You're on multiple hospital committees. We try to treat you like a hospital administrator from the beginning so that you learn how to be a CEO or a medical director in a hospital should you choose to do that. And of course, educational conferences funded, and you get even more funding. If you get a presentation at one, you'll get additional funding to go to lectures. I'm not sure how much more of this is helpful to go through. Of course, our textbook, both the board review book by Cucurullo and the main textbook, Bradham's Physical Medicine Rehab.
Sure.
What's that? I'm sorry. So, of course, we provide memberships through American Association of Academic Physiatrists, Association for Physical Medicine Rehab, Texas, and National Societies, training certifications, and ACLS basic life support, and subscriptions to the archives, as well as on-site access to the library I talked about. We'll give you PM&R board review courses you get late in your program. But we can go ahead, Maria, keep going. Slides. This is just a bunch of pictures of our happy family doing everything from EMGs to Christmas parties to other events, but volunteer activities. We try to be engaged in the community. Go ahead, Maria. This is just a quote from me. I'll just read it. I mean this. I'm honored for the privilege to serve as the founding program director for this PM&R residency program at Texas Rehab Fort Worth. The facility, administrative leader, staff, and I at the hospital here care deeply about the people of North Texas, and as such, we will provide the best training possible for the next generation of physiatrists to serve in this area. Working together, we intend to make North Texas a stronger, happier, healthier place for generations to come. Just heartfelt that we're in it because we're trying to train the people we'll work with for the rest of our career, and we look forward to working with you, of course. So Twitter, I guess now X, you can connect to us through there or through all these other methods to connect with our program and learn more through that. And of course, as I mentioned, the benefits are all listed under that website at Texas Rehab Hospital. Anything more, Maria? Is that it?
That is it.
Questions. So I don't know what my time limit was on there, but I was trying to get it done in 10 minutes so we have more time for questions than for just listening to me talk. Maria, have you had any chat questions so far?
Let me check.
We are at about 8 minutes.
Please, there's one question on here where it says, was there a children's hospital rotation? And the answer is yes. There's a full month in PGY3 and another full month in PGY4, working with a PM&R pediatrician in their inpatient and outpatient clinical services at Cook Children's Hospital, the largest children's hospital in Fort Worth area. So is the program international medical graduate friendly? And we are absolutely, if you look at the picture that's in front of you here, you see a lot of diversity, both in our faculty and in our resident team, and also, of course, in the staff that's there. We want our graduates to represent the people they'll take care of. And so, so not just general diversity within any applicant, but we certainly would look at any international graduate. I believe we have one of our first residents in was an international graduate, so it certainly is on our list. I don't know if I missed a couple questions here. Maria, I know you're kind of looking at them. If you have some that you want to choose, please tell me about them.
Okay, I'll try to get through all of them. Is there any step 2 CK score cutoff, clinical knowledge score cutoff? Oh, you're muted, Dr. Stoll.
I don't know how that happened, but so I'll keep unmuting it. But the answer is we do not have a cutoff for scores. We look at the comprehensive applications, letters of recommendation, your personal statement, your grades through med school, and certainly that you pass. We do have a requirement that you're pass, but no, we do not have a number cutoff.
Okay, Dr. Ahmed and Dr. Wright, I think this question is for residents. What would you say makes our program unique?
So go ahead, Dr. Balch, would you like to answer that?
I was going to go for it. I
Please.
think what makes the program unique is you have a lot of opportunity. Like, I've been very fortunate to become chief resident, and then I'm interested in pain and spine, and Dr. Balch has kind of like aligned me with the right people, along with working with himself in his clinic. So I think the opportunity is there for whatever you're interested, whatever self-specialty. It's just a matter of what you want to do. And then on the other side of medicine, more the business side, I think we get a very big insight, which I think is very unique to our program. You get to kind of learn how the medical directors do their job, how you run a private practice. So I think it's very unique to our program.
if I could just add to that, I believe as general numbers, about 80% of residency training is in an academic setting. And yet in reality, about 80% of clinical care occurs in a community-based setting. And we are certainly a community-based hospital. And so when you come here, you're going to get unique one-on-one experience directly with the community-based practicing physicians and a broad spectrum across all of Fort Worth clinical community.
Okay. Do you have focus on any specific subspecialty during training?
And so, anybody else wants to jump in, they can. I'll be glad to keep answering. But we have a strong interventional pain program and a strong inpatient program. So if anybody wanted to come out of here and be a medical director, I get every year lists of people asking if our residents want to take a job as the medical director at a hospital somewhere. So there's always that opportunity. Electrodiagnostics, if you wanted to specialize in that. I think and we have room for electives as well. We look, other than the core curriculum, we look for each resident to tell us what they're most interested in and try to help them focus on that. But as a program, I think the answer would be no. Our focus is to be eclectic and broadly general rehab preparation.
Okay, next question. What is the typical path of residents after completing residency in terms of fellowships or general practice?
So
I think I can answer that. Oh,
please.
sorry.
No, go ahead.
Oh, I was just going to say we're a newly accredited program, so we're actually in our second full year. So we haven't seen that yet, but I'm sure it'll be great. Another question.
As you said, we are affiliated with the country's largest sports medicine fellowship, and they are eager for our residents if you're interested in that. But I think that any fellowship you'd be interested in would be available to you.
Absolutely. Have residents had any interest within PM&R outside of the core curriculum / didactics? And if so, how have you been able to support their unique educational interests?
So that's one that I kind of want to jump in to talk about a little bit. So for me, I have an interest in cancer rehab, which isn't something that we formally have at Texas Rehab, but I apologize. But ultimately, everyone has been so supportive with helping me to get an away rotation established early on, so that hopefully I can get a couple of extra away rotations in something like cancer rehab, which is fantastic.
Thank you, Evan.
And that's kind of the quick answer for any place. As we're getting started, we're growing electives. Some of them may turn into requirements, but you bring an interest and we help you connect to it anywhere throughout Texas, really anywhere you want to go. I don't think there'll be an issue for getting a spot.
About 2 minutes left.
Thank you. Is there a cutoff for IMGs when it comes to years of graduation?
No.
Okay, and this looks like the last questions. Oh, well, never mind. Okay. For mentorship, is it formally set up during PGY2 or is it more informal based on fellowship internship?
So, sorry, did somebody wants to comment? To say the setup that when you come in, you're assigned a resident and a faculty mentor, but we encourage people at any time you want to switch that, no hard feelings. You find somebody that you have a better relationship with. So it's assigned, but then free to get your own mentor wherever you might find them.
Okay. And what are some important aspects you look for in applicants?
Diversity of background, education. We like to see people with broad experiences. They've tried a lot of things, hopefully failed at a few things. And a good personality. We interview people and want to see people who can talk and communicate and be gregarious and evidence that they're emotionally mature and intelligent and interested in rehab. And I think also interested in North Texas is a plus, but anybody else want to add to that? Dr. Balch, maybe? I guess you're muted.
Yeah, I think, sorry, I was muted. Yeah, no, I think, we're really looking for a well-rounded person who has interests, in rehab, a genuine interest in rehab. And then also, somebody who's a team player, somebody who knows how to work with a team, because rehab is all about working on a team. You're working with therapists and case managers, and you're also a patient advocate, a patient's family advocate. So somebody who really adapts well to being a team player. We're really looking for team players. That's really important in rehab.
Perfect. Thank
With
you.
that,
And I
we
think
will-
that concludes us.
Thank you both so much. We appreciate all of you for joining us. It's a really great presentation. Thank you for your evening.
Thank you for having us.
Mhm.
Have a good night, everyone.
Thanks.
All right, thank you.